X. I think there's a number of other platforms, Facebook as well. A warm welcome to you from Geneva, Switzerland. I'm Rida Sadki of the Geneva Learning Foundation. We're about to start something special and something new for Teach to Reach as part of Teach to Reach 11, which was held on the 5th of December 2024. We're now 1 minute and 10 seconds away from starting what we call the Reach Network, which is really peer learning for health leaders. So I'm here with Maria Fernanda Manzan. Maria, a warm welcome to you. Tell us where you're connecting from and what the time and temperature are right now for you.
Hi, Rita. Thank you very much. I'm Maria Monzon. I'm connecting from Corrientes, Argentina. So we're starting our summer in a few days. It's 9 a.m. and it's pretty hot already. So looking forward to a very productive session learning with all of you.
Great. Thanks, Maria. We're 38 seconds away. We have a lot to do today. Everyone entering the Zoom studio on our brand new conference platform. Let me just show that to those of you who are watching across social media. You can see here. If you're watching from the lobby, please, you need to reserve a spot, and that is how you actually join the session. This is going to be a fully interactive session, so there is no other way to participate unless you are joining the session on our events platform, and that requires you to be a Teach to Reach partner for your organization and a Teach to Reach participant. Here we go. You are, however, welcome to watch. All right, a warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation, here with not unfortunately Charlotte, who is away, but with Maria Fernanda Manzan. It's a real pleasure to co-host this session, this Reach session with you, Maria. How are you doing in Corrientes, Argentina?
Thank you so much, Rita. I'm doing well, and I'm looking forward to this Reach Network session. So we have a lot of participants. It's going to be pretty amazing today.
That's wonderful. So let's get started. So this is part of Teach to Reach 11. It's really peer learning by and for people who work for health. We had a special focus actually since Teach to Reach 9 in 2023 on the front lines of climate change and health. And in fact, just last Friday, Maria, we held the Lancet Countdown session. So with the managing director of the Lancet Countdown, tracking progress on health and climate change. But today is something new and different, and that is the Reach Network, peer learning for health leaders. We asked this question about Teach to Reach. What is Teach to Reach in one sentence? So for this Reach session, we're actually going to ask you, what is this Reach for leaders? We're going to pick I don't know, Maria, who you'd like to ask this question. And if you're watching on YouTube, Facebook, Twitter, X, and you've participated in these sessions before, tell us, what is Reach for leaders? Who would you like to pick, Maria, that we can hear from for the answer to this question? And please do.
Well, I'm asking Eda Canini.
All right.
Eda, you're unmuted.
Warm welcome, Eda.
We can hear you, Eda.
And don't forget to introduce yourself. Tell us who you are and what you do, how you work for health. And then try to, in one sentence, tell us what is this Reach for Leaders session that we're holding today?
Yes. Thank you very much for ambushing me. My name is Eda Kanini. I'm joining in from Kenya, public health monitoring and evaluation specialist. And this last Teach to Reach session, I would say it's more on networking. It's like celebrating our successes, which we have achieved for the year through networking, sharing, and learning from one another as we end the year 2024. That's what I would say in one sentence.
All right. Thanks, Eda. That's a great way to put it. So if you'd like to request to speak, just look for the raise hand icon. We do ask you to type your message in the chat, then raise your hand. Check your microphone and headset, your connectivity as well. And then when we call on you, you can unmute your microphone. I think Mohammed Quresh maybe has a hand raised. Maybe Mohammed, you wanted to also answer this question. Don't forget to introduce yourself. What is this Reach for Leaders, which is this session that we're holding today as part of Teach to Reach 11? Mohammed asking you to unmute. I don't know if that was, if you have your hand raised, we are likely to call on you. Oh, I think I may have accidentally muted you again. Please go ahead.
Thank you, Reda. Thank you, Reda. Thank you, Reda, and the Jalat and the entire team here. I really appreciate. My name is Mohammed Quresh Jimale from Ethiopia, particularly Somali region state, and I'm the field coordinator of PSF Swiss organization. And really, if I say one sentence, is just a more of collaboration and coming together and learning and sharing English ideas over the world. And I really appreciate this platform. Thank you. Over to you.
That's a great way to put it as well. Thank you, Mohammed Quresh. Let's go then. Reach for Leaders, special networking for leaders, one-on-one meetings, and dedicated communication channel. We've launched the first two. Today is really going to be focused on thematic group discussion. We're going to explain how that works. And our focus is on local organizations, and that is a Teach to Reach partner organization that is based in a community, has a mission to serve community needs, is led by community members, and is accountable to the community that it serves. So we have some 3 reasons to partner with Teach to Reach. Maria, can you recap them for us? What's the point? Why should an organization get involved and become a Teach to Reach partner?
Thank you, Rita. Well, the whys are many, but here we're just exposing some. You will be able to develop your organization, share your experiences, increase visibility, and access opportunities. Let's offer opportunity for all staff, volunteers, and community members to learn and to develop.
That's great. Thanks. Thanks, Maria. And benefits for organization really around global collaboration, skill development, problem solving, community engagement. So not only can you participate as an individual in Teach to Reach, you can also join, your organization can join and benefit from Teach to Reach in many different ways. So far, we've had more than 4,000 health leaders who've already participated in the Teach to Reach partnership process, including more than 2,000 Anglophones. And really, we saw with Teach to Reach 10 in June 2024, unprecedented scale and engagement, just more than 2,400 individuals representing organizations who participated. You can see some of the other stats here, and a broad range of organizations. You can see what we're really proud of is the participation of government agencies, especially those at the local levels that are joining Teach to Reach as partners, but also, of course, the many civil society, other nonprofit advocacy groups, social enterprises, as well as educational institutions. So there are participants, organizations joining from 77 countries across the globe, but strong representation. You can see the top 3 countries are Nigeria, that's on the Anglophone side, and then the Democratic Republic of Congo and Ghana, but there's then a wide spread of folks joining. You can see also on the 6th of November when we kicked off the first Reach session, more than 300 participants, and you can see a healthy mix of organizational leaders from the community level all the way to the national level, and then again civil society organizations, other local organizations, and all the way to government agencies. So today is going to be, we're building on what we've done in previous Reach sessions. Of course, we completed Teach to Reach 11 on the 5th of December. This is formally a part of that session. We're going to meet, connect, and learn. A very simple 1, 2, 3 process. This is how you request to speak. Now we're going to put you into discussion groups, and in order to do that, I see that there's still around 9 people who have not yet answered the poll. So if you do not answer the poll that you see on your screen, you're not going to be able to join a discussion group. So please, we're going to take a few more seconds because we are right now going to send you into the groups for discussion. That is how we are supporting health leaders to meet, connect, and learn. You'll be going to discussion groups across a range of themes, and this is really part of the networking session flow that you can see on your screen here. From joining a session, meeting in groups to share experience, to listen to others, to connect with peers, and then to decide how you want to extend this session. For those of you who are watching the live stream on YouTube, Facebook, Twitter, X, I think there may be some other platforms, LinkedIn, of course, we're keeping an eye on your comments. For example, Kabdi Rashid Muse, who says, interesting session. Tell us what you find interesting so far. Rula Barake says, hello from Palestine for all. I think reach for leaders means humility, cooperation, and listening to others to reach the goal. We also want to greet a few of you who are joining, such as Peace Eridre from Nigeria, registered nurse midwife working with Duchess International Hospital. Glad to be here today, she says. Unfortunately, we don't have time to, if you don't see the poll, look for the polls quizzes icon. It's 3 little vertical bars to make sure that we still have 6 people who haven't answered yet. We are going to end the poll because we want to send you to the discussion groups right away. So, last chance. There's still 7 people who are going to stay with me and Maria in the... All right, let me share the results here. So you can see right now we have... so this is only visible for folks who are with us in our Zoom studio. And so we have... let's take a look here. So we have a group of 24% of REACH leaders who have selected actually the Leaders and Partners Forum. 27% are going to participate in the discussion on the Immunization Agenda 2030 and the movement for IA 2030. 25% united to end malaria. 24% on climate health risks and barriers. And strangely enough, I'm not sure why that is, extreme weather events and food and water security, which are actually topics identified in a previous REACH leader session. No one has selected those. 63% of you are seeking partners. 20% need help with a challenge, 8% have a success story to share, and then 10% want to share a lesson learned. So again, a warm welcome to those of you like Anthony Okungu, who are from Kenya, who are joining the session, following, I think this is from YouTube. Unfortunately, Anthony, you won't be able to participate in the discussion groups, but if you are not a Teach to Reach 11 participant and your organization is not yet a Teach to Reach partner, we'll still continue the discussion in the plenary with those who around the themes that we are discussing. So that is going to be the split. You will be able to change from one room to the next. So I'm going to stop sharing the poll here. Let me just and now we want to really review what the different groups, the different discussion groups for today's session are all about. And really, we should be, by the 15-minute mark, we should be going into the discussion groups. So first of all, if you selected the Leaders and Partners Forum, your focus is probably on developing your organization. And so we suggest, and these are only suggestions, once you have introduced yourselves, you're free to discuss whatever is meaningful to you as health leaders. What's the biggest challenge faced by your community? We have asked you this question a lot. We believe it's a really useful starting point to understand. And then because you are organizational leaders, we ask you, how does your organization help? We also suggest, for those of you who are joining the Leaders and Partners Forum, that you explore local solutions. If you have something that your organization that's done, that's a sort of a clever local solution, it might be of interest to other organizational leaders. What did people do? How did you know it helped? You could also share your organization's experience of Teach to Reach, how your organization has applied, what you learned. Now, for the Movement for Immunization Agenda 2030 session, we had a big focus on the Nigeria IA 2030 Collaborative. So you do not need to be Nigerian to join the session. And if you are from Nigeria, you do not need to join this particular session. All countries are welcome, but the idea is to share around the experience and the challenges of immunization. The same with malaria. There we suggest that you discuss how severe malaria affected someone close to you, and then a time when your community came together to fight malaria in a way that really worked. Many of you have selected the climate health risks and barrier discussion group, so we suggest there that you tell us about what's hurting, what's hindering, what's preventing you from doing what you'd like to do as you see climate-related health problems. What are the obstacles that you face? So that is These are only suggestions. You are free to discuss whatever you want. The discussion groups are private. We'll be asking you when you return to the plenary what you discussed and what you're taking away. We'll also be doing, of course, a follow-up value creation survey to understand what the value has been for you. Damage to health services. And although no one has selected food and water insecurity, these were not main sessions at Teach to Reach 11. You can still discuss a time when you saw how food or water insecurity affected health in your community and extreme weather events. We actually received very, very powerful, compelling stories, experiences shared before Teach to Reach in response to Teach to Reach questions, whether that's on floods, droughts, or heat waves. So I think, Maria, that's about it. I'm just going to check in with you if you see any burning questions or issues before we actually go into the networking.
Not at this time. Just people introducing themselves in the chat. Some that Mohammed Quresh says that he missed the poll, so he wanted to be included in food and water. So yeah, this is about it. So it's a lot have joined just now, so those might have missed the poll.
All right. So let's see if we have. Okay. So a little bit. Let me see if we can recover to pre-assigned rooms. No. All right. And recreate all the rooms. Okay. No, we don't want to do that either. So we're going to open all the rooms. It looks like the assignments have not happened automatically, which they're supposed to. Let me see just what's happening here, because this is the first time we're using this. So all right, if there's anything we can do here, it doesn't look like it. So we're going to go, everyone is going to have to choose whatever your initial choice was. You're going to have to choose which room to go into. We know this is going to take a while the first time you do it. So let me just see if we can open all the rooms, and perhaps then the magic will happen. So first we'll give you 5 minutes just to introduce yourselves, and then we'll go into a more intense discussion. So we're opening up all the rooms. I see. Yeah. And so here's what you now need to do, which is different from what we have done in the past, where you were automatically sent to a session. Let's see if I can find where this went. So first of all, you should see something that says join a breakout room. So you need to do that first. And then second, you need to actually click on the join button for the room that you are interested in joining. All right, so that is so it's really 2 steps. First of all, you have to find the join the breakout room, and then you have to actually go there. So right now we see, okay, no one has joined the Leaders and Partners Forum. Okay, Joseph Agina has joined, but Peace Eridgeway, who's been assigned to that room, has not. So please, and for those of you who are not assigned, you're going to have to choose the room that you want to go to. Okay, we can see a few people joining now. I wish I could show you this. I don't think there's a way to actually do it. Right, so as we see the rooms fill up with participants, we'll do this, especially for the first time. We're only going to ask you to introduce yourselves. I'm actually going to broadcast my voice to all the rooms. All right, you have just a few minutes, 3 minutes, 30 seconds to introduce yourselves. We'll then pull you back into the plenary to see if there are any issues or problems, and then we'll send you back to the breakout rooms so that you can actually deep dive into the discussion on your selected theme. All right, there. Now, for those of you who are still here, and there are many, okay, we still have almost 50 people in the room here. So we're going to look at, so again, go back to the procedure. You're really missing out if you're not going to joining a breakout room. Okay, but I see we have good, all right, we only have 2 people in the Movement for Immunization Agenda 2030 room. So again, look for the 4 white squares, and then click on the blue button that says join to join the corresponding room. For those of you who are still here with us, well, we're going to discuss, we're going to ask you to participate here so that for those of you watching the live stream, you can still enjoy this. Again, just want to make sure that everyone here understands how this works. We just have 2 minutes, so maybe let me just see if there does seem to be activity, except in the Leaders and Partners Forum. Maria, could I ask you to join that room? Because there seems that...
This is my group.
Kabir Mustafa? Yes. So, Kabir Mustafa, you need to join the breakout room. And you do that, follow the instructions on screen. If you're on your phone, look down, and you may need to swipe left or right, Mustafa, in order to see the breakout room. Click on the 4 little white squares. So not the one on my slide, which is being shown, but at the very bottom of your screen, and then click on join. And that is how you're going to be able to access, Mustafa Kabir, your room. All right, and I think it just went there. Let me see if there's anybody else who is... all right, and I see food or water security. There is no one who has actually joined. Okay, I see Patience Monye. Yes, Akabwa Abdul Mumin, your microphone is unmuted. So please tell us what's on your mind. What are the issues you'd like to discuss today with fellow health leaders in this REACH session? All right. So we're going to ask you, those of you who are still in the room with us, all right. Don't worry. That means you get to stay here with me. Let me go to Eunice. Eunice, go show me. Are you there? Are you available to speak to us?
Yes, I'm there.
All right, Eunice. So tell me, you haven't joined the breakout room. So let me just ask you, can you introduce yourself and tell us what you would like to discuss with fellow health leaders? But first, introduce yourself, please.
Okay, my name is Eunice Koshomi. I'm a midwife. I work with pregnant women. And then I've experienced the changes which occur with the climate change, and then the mental health instability caused by the extremely hot temperatures, and then the preterm babies and which are being delivered, and then also the upsurge of malaria because of the hot and conducive climate, maybe environment for breeding of mosquitoes. And then we're also using the clearing the environment, and then also burning all the grass and cutting it short, and then also pouring oil in the stagnant water so that the mosquitoes won't breed. And then we also have also distributing mosquitoes for the pregnant women and the under fives. So this is what actually is happening.
Thank you, Eunice. And so what experiences,
so it's like I'm failing to...
What would you be looking for from your colleagues who also are working in the field of malaria? What is one question that you would like to ask them?
So it's one question. What I ask them is what challenges they get, are they experiencing in managing their different environments, in managing the mothers with the malaria, and then the issues which are problematic, and then how they evade those or litigate the problems.
Thank you, Eunice. We'll try to make sure you can join the malaria discussion group. You were stuck with us in the plenary. I just want to welcome back everyone, all the health leaders participating in this REACH network session today, peer learning for health leaders, and these are the organizational partners and their representatives who are joining today. So welcome back. Is there anyone? Let me just mute everyone, and then going to ask you to raise your hand if you'd like to tell us how the introductions went. I know there was one room, I believe it was the food and water security, that had just 2 people, so maybe Patience Monye. Let me see if... Oops. Yeah, sorry, that wasn't supposed to happen. Yeah, if you could raise your hand. So we are asking you to raise your hand before you unmute. We've had too many issues with the microphones. Yes, Mahesh, would love to hear from you. How was the intros? First of all, what what discussion group did you participate in, and how did it go?
Hi Reda. It was good. The introduction was going well, but I was in this group for climate change and health and barriers in this that issue. So the introduction went well, but since the number of the participants were, I think they were around 6 or 7 participants. So two participants they could not complete their introduction. So that was the part, and four participants they completely introduced themselves, and they were representing all the areas. And in my view, because since this climate change was related with the food and water security and extreme weather events, so that's why most of the people who are interested in these two, they might have gone to the for the climate change and
Sure.
health. So I think that may be the reason that nobody was in that group. That was my opinion. I don't know whether it was right or wrong. Anyway, thank you.
Thank you very much indeed, Mahesh. Let's go to one more participant. So that is pharmacist Bernard Badu-Bediako. Over to you. We'd love to hear from you. Remind us who you are, what you do, how you work for health, and then tell us were you able to introduce yourselves and what discussion group did you participate?
Thank you very much. Hello to everyone. Yes, so I am Pharm Bernard Badu-Bediako. I am a public health specialist, a pharmacist, and a district director of health services in the Amansia West District of Ghana. Actually, I joined the malaria session and
we just lost you. All right, Bernard said he joined the...
a very fruitful discussion.
Yeah, you're breaking up, unfortunately. I hope it goes better than that when you join the discussion group. We do ask everyone to do the best that they can with their connectivity. Otherwise, this is a fully interactive session. We're only pulling you back into the plenary and then staying with those of you who have issues, whatever the problem may be that prevents you from joining the discussion groups. But this is a discussion for health leaders following up on Teach to Reach 11 on the 5th of December. And in fact, we're going to go right back, this time for a 15-minute round, so you do have much more time. Again, we have some suggested questions, which are the questions we've been asking you through Teach to Reach. If you join the Leaders and Partners Forum, we encourage you to share your challenges and explain what exactly does your organization do to help. If you join the Immunization Agenda 2030 discussion, of course, you can speak about any of the immunization challenges. It is not only focused on Nigeria, even though we appreciate that Nigeria and the DRC are the two largest communities in Teach to Reach. United to End Malaria, we have some suggestions, questions around severe malaria affecting someone close to you. If you participated in Teach to Reach on the 5th of December or in the special event on malaria, of course, you know about these questions. If climate, health, risks, and barriers, we encourage you to discuss what is hindering your efforts. How are your organizations mobilizing and responding to the challenges such as damage to health services? Food and water insecurity is another theme, as are extreme weather events, whether it's floods, droughts, or heat waves. So let's go back this time. So you're going to go back. By default, you'll see that you are assigned to the same group, but you are free to move around. And so here we go. For those of you who do not yet understand or have technical difficulties figuring out how it works, you're welcome to stay with us in the plenary, and we'll be inviting you to share. This is also for the people on the live stream. So if you're watching on YouTube, Facebook, Twitter, X, if you're not a Teach to Reach 11 participant or your organization is not yet a Teach to Reach partner, you can still get the benefit. We're really opening the gates of Teach to Reach and including this Reach session. So the rooms are open. There are 32 of you who need to choose a room. Everyone, however, we're not automatically sending you to a room, so you do need to click on the 4 little white squares where it says join a breakout room or where it says breakout rooms, and then you need to choose which room you'd like to join. So we have extreme weather events, the Leaders and Partners Forum, United to End Malaria, climate health risks and barriers, food and water security, and then the movement for immunization agenda. So we see, okay, so rooms are now, I think we may need more rooms because of the numbers. The groups may be getting a little bit too large. So in this case, in response to Mario, who said, please send me to the leaders room, Mario, you need to send yourself. So follow the instructions that appear on your screen, and you should be able to join the room of your choice. So that is really how it works in this session. For those of you who are still here, we're just going to ask you to raise your hand if you'd like to share. Tell us, introduce yourself, and tell us if you're having a technical difficulty. Tell us what it is, and let's go to Traoré.
Yes, 3 fois dans la semaine.
Yes.
Ça demande.
Okay. Traoré Sédou, are you there? We're trying to speak. Okay, looks like.
Maintenant, Nio, qu'est-ce que c'est ça?
All right, I think Traoré Sédou is busy. Let's go back to Eunice Goshomi. Eunice, we actually spoke with you, but then we had the rest of the group come back into the plenary. Are you still there? Love to learn some more about the work that you do around malaria, and then we'd like to call those of you who are still in the plenary with us, so who haven't gone to the discussion groups, to respond to what Eunice is going to share. Eunice, can you remind us where you work and what you do?
My network is at Salim Mugabe Central Hospital in Zimbabwe, and then we are affiliated to the Women's in Africa, and then at the Women's in the hospital, it's like we admit the mothers who would have a problem. Some of them would admit them of the extreme temperatures. It's like they go into preterm labor. So when they go into preterm labor, some of those it's able when they are given medications to stop the contractions, and then it will work well. And but others will find that if they come in with malaria, you would find that it depends with the severity, with severe malaria, and then also they discovered that the pregnant women, when they get malaria, because a lot of it harbors a lot of maybe blood cells, and then it allows the malaria life cycle also to be completed very fast, and then it causes severe malaria in pregnant women, and then it's like it's either the mother is very ill, and then or the baby might be delivered prematurely, and then the baby might also suffer intrauterine growth retardation, and then they're underweight, and then we admit them. We treat them with the malaria symptoms is either the mother or the baby who is admitted in the neonatal intensive care unit because of the condition, the severe condition of malaria as they present themselves. So and then it's like, and then there's also maybe the teaching in the university about the malaria cycle, and then also seeing the trend of malaria on the globe. Or in the region with those other teaching units, also to maybe to discuss the implications and then what research areas to do on malaria. So this is basically what we what.
Thank you, Eunice. Can I ask you, were you there with us on Tuesday, on the 10th of December, to for this special event on Health Workers United to end malaria? Oh, I think we may have lost Eunice. Are you able to still speak to us? Your microphone may be muted, or you may have poor connectivity. Going to tell you about this event, I think is if you haven't. For those of you who missed it, who are not with us, not able to join for whatever reason, professional duties, connectivity, field work, we're now rerunning the event every 4 hours. So you can see right now, you can catch it. You just need to request your invitation, and you'll then get the email that takes you to the recording. So if you haven't done this yet, you're welcome to do so now. So we are speaking with health leaders now. Almost everyone has gone to discussion groups, the thematic discussion groups across a range of issues. We have the Leaders and Partners Forum, the malaria discussion group, a discussion group on climate health risks and barriers, as well as groups on food and water insecurity and extreme weather events. So really the purpose of today's session is to support health leaders to meet, network, and learn across these topics: extreme weather events, food and water insecurity, climate health risks and barriers, malaria, the Movement for Immunization Agenda 2030, and then really supporting leaders and partners to connect with each other. A warm welcome to Janet Aidu, a pharmacist and mental health advocate from Ghana. So let me go to you, and let me see if we can hear directly from Janet, who's just... Yes, Janet, are you there? Are you able to speak to us? All right, Janet, we're calling on you. You may have been busy for Omodele Adeola, who missed the poll. Don't worry about it. Let me just see if there are others. Please do raise your hand if you'd like to speak. Otherwise, we'll also, of course, call on you. So, for example, we'd love to hear from Sarah Yeboah or Ninette Eloku, as well as Gregory Agogo. We recognize some of you from the Teach Reach 11 sessions, but it looks like there's also many newcomers who've just discovered the Reach sessions. Gregory, are you able to speak to us? All right, also calling on Ninette and Sarah, as well as...
I have a lot of difficulty with
Yes, Gregory, we just heard you say you had a lot of difficulty, but we did not hear you say with what.
difficulty with the network. The network comes on and off.
Yep.
And I've been trying to join. I don't even know the room I am in. So let me continue to try. Maybe
okay, all right. You're also welcome. One of the reasons we keep the discussion going in the main room is because in our Zoom studio, is so that even if you're not able to join the discussion group, you're welcome to stay with us here. We heard we're going to be sharing experience and really going through that process of meet, network, and learn that is key to Teach to Reach. We also have, this is also where we have the live stream going. So where there are many, for example, Haruna Hamza, who's joining from LinkedIn and actually joining from Nigeria. So Haruna Hamza, tell us where exactly in Nigeria, and tell us how you work for health and what your interest is in leadership for health and peer learning for health leaders. If that's at the core of the Reach network experience that we're having today. Most of the Reach leaders are currently in discussion groups. So let me just check on how the discussion is going. We can actually keep an eye on keep an eye on the rooms, and there seems to be some lively discussion going on here. I also wanted to make sure that Maria Fernanda Manzon, my co-host, is able to join us and to move around the rooms. Yes, Maria, I just wanted to check with you that you are able to move from room to room. Of course, if you want to just return to the rooms, you can do that. And we're trying to kick off a sharing of experience and a Reach network discussion across the themes that interest those of us who are stuck in the main room of our Zoom studio. How is it going for you?
It was going very well. I was participating in a pretty fruitful discussion in the Leaders and Partners Forum. So I'll just move around a bit now.
All right, wonderful, thank you. All right, and then
thanks.
here in the room again, if you'd like to share on leadership and partnership, if you have a specific need, if you're seeking partners for a specific reason for your organization, please raise your hand so we can hear you. You can introduce yourself and tell us about that. If you'd like to share about the movement for Immunization Agenda 2030, or more specifically, if you have a challenge, a lesson learned, a success story, a request with respect to immunization, we focused on Nigeria at Teach to Reach 11, but of course, all countries are welcome to contribute. If you would like to share your experience, and again, if you have lessons learned, successes, challenges to share around malaria, you're welcome to do so. The same on climate, health, risks and barriers, food and water insecurity, and then extreme weather events. Today's session is really the purpose of this session, almost 2 weeks after Teach to Reach 11, is really to continue and deepen the networking and learning and sharing that happened on the 5th of December. So looking at now to see who is still in our main Zoom studio with us. I'd like to go to Esther Yakubu, Gidado Yusuf, Dio Gracious Mapendano, Dr. Tusime Ramadan. You're all welcome. We're asking you to activate your microphones if you'd like to share with us on any of these themes. Dio Gracious, I thought I heard your voice.
Are you getting me?
Yes, Dr. Tusime Ramadan, always a pleasure to hear your voice from you.
This is Dr. Tusime Ramadan from Uganda, retired medical doctor and working with Humanitarian Volunteers International, working as a country director.
Indeed. And so as the leader of a volunteer organization in Fort Portal, Uganda, Dr. Tusime, can you tell us, what are you seeking by networking at Teach to Reach? What do you have a specific question for your colleagues? Are you here to share your lessons learned, your successes, your challenges? Are you seeking partners to support your work? What is your purpose in today's Reach for Leaders session?
The first question, I would like advice from other colleagues that in Uganda, malaria is getting resistant. The disease-resisting drugs. If there is anything out there, someone can tell me what we can do. Then another thing, the challenges is that we have misinformation. People fear vaccines. People fear immunization, thinking that there are hidden agendas behind that, and that is a challenge. Another challenge is hard to reach areas because this is a rain season. We are under Mountain Rwenzori, and the floods and problems and earthquakes are many. So the two challenges plus the advice. Maybe any question from you, Reda?
No, these are very interesting for you to share, and really calling on other leaders who are with us in the Zoom studio. It's true, most health leaders participating in today's Reach session are currently in the breakout rooms, so really focusing in specific discussion groups. But I'd like to call on those of you who've listened to Dr. Tusime's introduction to let us know if you'd like to respond to it. You can raise your hand. Okay, I think Umar Turaki is trying to raise his hand. It's actually raised a thumbs up. And there is Ayebale Simon. We'd love to hear from both of you. Simon Ayebale, are you there? Are you able to speak to us? Same question for Umar Turaki.
Yes, good afternoon, everyone. Here in Uganda, it's afternoon. And I'm Simon from Uganda. I work with FAD is Fisher Folk Health and Development Initiative, and this is a network which operates nationwide across the Great Lakes of Uganda, and we have a big population of around 12.5 million people surrounded by waters, and we live in landing sites and islands. And these are very tricky area to control because they have high breeding areas for vector breeding, the swamps, and muddy water is always there. And I want to share with you if you can give me better experience on how we can control vectors in such areas in environmental friendly way. Because these vectors, if they are not eliminated, it becomes hard to fight malaria. And most of the 70% sickness for the people around the lakes is malaria. When you go in those health centers, you find most cases are malaria center, and this one brings a lot of poverty because if you treat patients every month suffering from malaria, it affects the household income level. And the treatment in Uganda is very expensive. So comprehensively, I want to share with you this, and I can learn more with members who are living in such environment and have managed to reduce the vector multiplication. This
Thank
is
you,
another mosquito in Uganda which causes malaria. Thank you.
Thank you, Simon Aibale. We have everyone coming back from the discussion groups right now. This is the REACH Network, Peer Learning for Health Leaders. And we have groups, discussions going on across a range of topics. So leaders and partners meeting together. The Movement for Immunization Agenda 2030, malaria, climate change impacts on health, food and water security, extreme weather events. So this is a unique opportunity within the context of that follows Teach to Reach 11 for health leaders to meet, connect, and learn, sharing experience with each other across these different themes. We're at the 43-minute mark. We are going to be asking you if you think these sessions should be longer and shorter. Right now, we're just going to take, before we do a final round, maybe here, let me just lower all the hands, and then ask at least one of you to share what happened in your discussion group. Adeola, are you able to speak to us? All right. Otherwise, we'll go to pharmacist Bernard Baru Badiako. Bernard, are you there? Are you able to speak to us this time? I hope your connectivity has improved.
Yes, please. Can you hear me, please?
Yes, loud and clear for now.
Okay. Yes, hello to everyone. Please, I joined the malaria session and it was very, very interactive. Yes. So we discussed issues bordering on abuse and misuse of the anti-malarials. We also discussed what we call the intermittent preventive therapy of malaria in pregnant women, how we can help the pregnant women to avoid malaria. And then we also looked at the economic impact of malaria on the family and on the society or community as a whole. So we realized that when it comes to the pregnant women, for instance, we have what we call the intermittent preventive therapy of malaria, where every pregnant woman, from the time of quickening, that is 16 weeks, every month, they are supposed to get this medicine called sulfadoxine pyrimethamine. So every month they would take it until they reach term when they would deliver. But we realize that some of the pregnant women do not report early for antenatal care. And so even for 3 doses, at least 3 doses, it becomes a difficulty. And so there's the need for a lot of education for the pregnant women to know the importance of coming for the antenatal care early so that they can be able to get at least 3 doses, though it is monthly, at least 3 doses, and it will help them to prevent malaria. And then also sleeping under the mosquito nets for pregnant women, it's also very key. I shared a situation where in Ghana, we've been able to share mosquito nets per universal health coverage. So every 2 people in a household is entitled to 1 net. And by God's grace, for our district, we're able to achieve 96% coverage of this ITNs. And we are hoping that going forward, malaria rate, which is 39.8% of all OPD cases in my district, we are hoping that by next year, with the interventions that we have put in place, by next year, it should be able to come down. We also realize that the issue of sanitation, weeding around our communities, preventing stagnant waters is also another issue. So there's a need for a lot of public education. If you take my district, for instance, it's a mining district, and the miners, after mining, they leave their pits open. And then when it rains, it becomes a breeding grounds for mosquitoes. And we know that if you get the female Anopheles mosquito, then she will be transmitting the malaria parasite. So there's a lot of education that should go on. And then also at our community pharmacies, we are advocating that our respectable pharmacists will make sure that they have the RDTs, the rapid diagnostic test kits, to test for malaria. So anyone that comes and presents with fever, they should be able to test and confirm that it is malaria before they give out the anti-malarial, and with proper counseling. Because with anti-malarials, there are specific times that you have to take them. So if you don't counsel the patient well, the patient will just go and take them anyhow, and it can breed resistance. And so these are some of the discussions that we had during our session.
That's
Thank
remarkable,
you very much.
Bernard. Obviously, Ghana Health Service is a very strong malaria control program. Can you tell us who were you engaging with in the room? Was it colleagues from other countries, colleagues who work in malaria or who work in other program areas? How was that for you? Was there anything that you learned from others in addition to sharing the strengths of the Ghana program?
Hello?
Yes, go
Please,
ahead.
can you hear me?
Yes.
Yes. Interestingly, we had a lot of participants being pharmacists. We also had a pediatrician who was also on board. And her concern actually was with the impact of malaria on the unborn child and also when the child is born. Because when the child is born and the child also gets cerebral malaria, or even the normal malaria, as we would say, it would affect the child's mental development. It can also cause low birth rate in the children, and they can also lead to an anemia in both the pregnant woman and also the child. And so from her point of view, she was also advocating that we shouldn't only focus on the pregnant woman, but we also focus on the fetus, the baby that is in the pregnant woman, so that we can help prevent malaria in the pregnant woman and also on the baby. In Ghana, we have moved from national malaria control to national malaria elimination. So now we have national malaria elimination program. That is why the government was very keen on making sure that there's distribution of the insecticide treated nets, and then also availability of the anti-malarials at the regional medical stores, so that the health facilities can source for these anti-malarials and make sure that we are using them. And then also the sulfadoxine pyrimethamine, which is used in the prevention of malaria in pregnant women, making sure that they are also available. And so we had, and then also our colleagues from Nigeria were also concerned about the peddling of medications. And so people peddle medications at the lorry stations, at the lorry parks, markets, and purported to treat malaria. And so meanwhile, the analgesics, they are only painkillers, but they are not anti-malarials. And so they give it to this innocent people that it will treat their malaria, but meanwhile it's not helping, and so their condition will aggravate, because it's only the parasia, the temperature, that will drop, but the parasites will still be there. And so we are advocating that people should either go to a community pharmacy where you can meet a qualified pharmacist, or you go to the health facility and make sure that you are tested. That is very key, because it's not every fever that is malaria. So there's the need for the
Yes, conscious of the time, I'm going to have to stop you here, but really appreciate your sharing such a comprehensive overview of, it's surprising you had very little time that you were able to discuss all of these topics. That's quite remarkable, and to the credit of the health leaders participating in today's REACH session. Again, there are other topics. Unfortunately, we're not going to hear from their discussion groups, but each of you will be receiving a feedback form, and that is where we ask you to share what you learn. We'll then be sharing that back with the REACH network organizational members, so the organizational partners, and sharing that back with all of the health leaders who participated in this session. We heard about malaria, but we also discussed, there are also discussion groups on climate health risks and barriers, food and water security, extreme weather events, impacts on health. Overall, our agenda is to meet, network, and learn. I am going to ask for, we often do a practical activity, and as we have just a few minutes left before we go any further, for Haruna, who's experiencing an extreme difficulty to join the Zoom room session, I'm betting it's about requesting a code. Look for the little envelope that says send code. We'll be sharing some more instructions to support you. But right now, I'd like you to go to the, for those of you who are in the Zoom studio with us. Okay, that was not quite how it was supposed to look, so I'm not going to be able to show you what I was hoping to, but look in the chat if you're in our Zoom studio, and you should see 3 steps. So I'm asking you to click on the LinkedIn link that I'm sharing in the chat and going to show you what happens when I do. And so this link actually takes you to the live event that is happening here. And let me see actually how you can, so you can actually leave a, leave your, okay, leave, it looks like you cannot actually leave a comment right now. Okay, let me see. So what we'd like to ask you to do is to leave a comment on this page before you leave the session, and also to share this event with others. So you can see networking here. There's also some features here if you have not done so. I think more useful would be to the announcement, but the idea, what I'm going to ask each and every one of you as we close out this session is, if you found this to be meaningful, will be make sure that one, you complete the feedback form. That's number one. Number two is that you then, the feedback form is important for 2 reasons. You can tell us how we can improve, and you can tell us what you actually learned. Next, we're going to be inviting you to a debrief, so we can hear from you. Would you like these sessions to be longer? Do you prefer the random matching where you just don't know who you're going to end up with and get to know each other? Or do you prefer thematic discussions like the one we had today? So we'll be asking these questions because we want the Reach Network to serve your needs. Quite a remarkable network so far. The premise for the network is what I'm going to show you now, and that is your team's daily work. So this is addressing organizational leaders. Individuals, of course, are also welcome to participate. What your team does every day makes you experts in that daily work, and that means you have something to share. Second benefit of the Reach Network is that you can learn from other organizations by sharing experience. You can become part of a global platform, network, and community. And then the fourth benefit is really, you can just grow not only your skills, but your entire team's skills through active learning. So we're going to have to close this session. We can't go the full hour because we need to start up the session for the Francophones that starts at the top of the hour. I'd like to invite you, if you have we have maybe perhaps room for one final comment. If there's someone who'd like to speak, please raise your hand. If you'd like to tell us whether we should have another one of these Reach sessions in January, raise your hand now or leave a comment as soon as you can. I am going to ask then Maria, who was my co-host, who was listening in into the different discussion groups. Maria, what did you hear? What are you taking away from this discussion?
Thank you, Rita. Well, I've been moving around in the groups, and I found it wonderful that everyone was sharing, that there were no shy participants, that people were bringing their experiences, the challenges, and it was pretty amazing to hear them all out and to hear how everybody else was giving their feedback on situations that they were going through.
Okay, but right now there's only 2 people who have responded to the call to action and said, let us have a session in January. So it looks like we may not have another Reach session if there's only 2 people who are with us in the Zoom studio who are actually expressing interest. Okay, then we have now 3. 3 still not enough to justify having another session. So if you actually, we will not do these sessions unless there is actual demand and unless this actually helps you. So Andrew, Fanina, Gifty, Yusuf Adamu, Win Hut. If you're watching on YouTube, LinkedIn, wherever you may be, also, this is your chance to let yourself be heard. We're thinking either monthly or every 2 weeks. And again, all right. Olaide Oyelaja, let's have another session in January. So we've got maybe 10 people. I don't think that's nearly enough to justify having a reach session in January. But all right, let's see. Maybe we've got a few more. And Ola Jumoke says it's a nice program, and Bashir Abdul Hamid adds to the mix. So remember, you're going to receive that request for feedback. That is critical. If we don't have enough feedback, if we don't have enough health professionals saying yes, these sessions are actually helping me to make a difference, we will not renew the experience. Once again, thank you, and we do think there is something tremendously important. For there to be another session in January, we're going to send out the call to action. We're going to need to see many more of your colleagues joining as well. Right now, the numbers are simply too low to justify continuing the Reach for Leaders session. So we'll be sending out that call to action. So make sure that if you'd like to see these sessions continue, we will only announce the next session once we have reached a sufficient threshold of registered participants. So that's it for today. And wishing you well, and look forward to hearing back from you through the feedback form and in response to the call to action. Thank you and goodbye.